Good morning. So now we start this session. This session is about safety and quality. It is the ISR QSA, the International Society of Radiology Quality and Safety Alliance session. And we have with us some esteemed professors and doctors who work in safety and quality. We're happy to have you all here. We'll start our first presentation by DINA HUSSEINY SALAMA from Egypt. Where are you, DINA? DINA will talk about justification, a challenging issue situation in Africa. Come on.
Thank you very much, dear Professor Ahmed, dear distinguished chairs, dear guests and colleagues. Good afternoon. It's my pleasure to present the justification as a challenging issue and the situation in Africa. I'm DINA HUSSEINY. I'm the chairperson of AFRA Management Program and the director of Medical Imaging Program at Must University and the Egyptian Atomic Energy Authority, and have been also honored to chair the Research Ethics Committee. In Africa, we have 54 countries, 1.4 billion people from diverse cultures and economies. And Africa also is the home to 6 of the 10 fastest growing countries in the world. And therefore, Africa is offering a wealth of opportunities for healthcare services. With a population of over 1.3 billion people, radiology market is enormous. And with rising innovations and economic growth, Africa requires careful planning and preparation due to various challenges and hurdles. So our healthcare sector in Africa is one of the major industries beginning to make an impact, showing signs of notable progress in hospitals and with professionals, access to medical imaging, and etc. The growth of the middle class in Africa is expected to continue, and this is an important issue related to justification, presenting new opportunities that include growing demand for private health services, new technologies, and upgrading health facilities. So, to discuss justification, we need to understand more the burdens on healthcare system in Africa, which is somehow different from other regions. The pandemic, the COVID-19 pandemic has a detrimental effect on Africa. We have rapid population growth. We have infectious and non-communicable diseases. We have high maternal mortality and morbidity, in addition to the environmental climate changes and ecological changes. So, I would like to say that imaging justification faces multiple challenges in Africa. This is the wall that separates our world of professional societies and regulators in Africa and the second world, which is the world of real practice in radiology departments. And when you talk to the world of real practice in radiology department, this is the impression about justification. So, why is this? Because I would like to mention that justification process is not integrated in the healthcare system, not integrated in management, operations, issues, systems, and technical needs, not integrated in teams, dynamics, and process strategies, staff turnover, infrastructure strategies. Also it's totally away from referrals and marketing strategies and leadership strategies. And again, we don't have one Africa. We have developed parts, not less than what's there in the developed countries. We have underdeveloped Africa. We have geographically inaccessible Africa, and we have politically inaccessible Africa. All this has to be put in consideration when we talk about justification in Africa. What about radiology departments? We have also two worlds. Look to your right side, and you will see the underdeveloped analog and wet film. It's still existing here in Africa. And look to the green side, we have the digital CT, MRI, fluoro, and top-notch equipment. So, in equity in radiology and radiation protection capacities, this is the first priority. Then, when we talk about justification, we should tailor this to these two worlds of underdeveloped and developed worlds in Africa. Let me again go to the depth in this radiology department. What these radiology department in underdeveloped countries have, they are suffering of lack of equipment, and they are suffering from underdiagnosis. So I don't understand really how we go and say CDS and clinical decision support to this side. And if we go to the green side, there is no lack of equipment. There is overdiagnosis is observed due to lack of justification. So the solution in the red side is to design a simple guidelines, booklet format suitable for only primary health care. This is those people what they need. And for the left side, or the green side, the solution is to support with CDS, integrated form, till the culture of using guidelines is created. So in this scenario, in the green side, we should emphasize on value-based healthcare to enable justification rather than talking about justification as a pillar only in radiation safety. So with the impact, let me go with you to the impact of justification being not incorporated as a part of value-based imaging. Besides draining the already limited healthcare system resources or unnecessary and low-value tests, the impact will be on the radiologist, on the training, and on the patient. The impact on the African radiologist is detrimental and special to Africa. Why? Because we have high workload, low income, no regulations for working hours. So, can you see this detrimental impact on the justified examination? There will be errors in interpretation and reporting of justified examinations by the radiologist. Why? Because of the quick brain drain going to non-useful examinations, because of the lowering of the index of suspicion and less time allocated to each exam. The impact on training, no time for mentorship, and this is what we need now in Africa, education and training. What about the working hours for radiologists? When we will have this, if overwhelmed with unnecessary examinations. The impact to patient is well known to all of you. Unnecessary radiation exposure, unnecessary cost, but don't forget, please, increased patients' waiting time, leading to detrimental psychological and physiological stress. But let me talk to the bright side of Africa. Africa was very proactive. In 2017, we were leading the assessment of appropriateness at the national level and at the regional level. We started in 2017 through a regional project that involves 4 leading countries who were motivated to join the assessment of justification and to train on the use of guidelines. We used 100 cases per clinical indication, and I'm happy to compare it with the ECR excellent session of Professor Boris, who is leading a project in Europe now with 7 countries plus 1 added with 1,000 cases. So we are not apart from the world and not deviating from all the proactive actions taking worldwide. And even when I look to the challenges of Europe, exactly is like our challenges with the audits there and the audits in Africa who performed this survey. There was no patient history of previous examinations. Guidelines are not covering all clinical indications. Our audits complained of these two as much as the European project audits, and the auditors too didn't agree on all whether in some examination whether they are appropriate or not. And with the AFRA program, which I'm honored to share this AFRA management program, it's 46 countries working together under the umbrella of African governments to promote radiation research, technology, education and training. And we hold a high-level policy meeting, and now we have radiation safety and radiology on the top list of our 5-year strategic plan. We are also the African experts. We didn't stop at this point. 1 month ago, 1 year ago, I'm sorry, we designed an SOP for implementing the clinical imaging guidelines, dividing countries into 4 groups in order to know how to deal with each department according to the infrastructure there available in each group. So it is more tailored approach to implement justification. And we designed a roadmap for assessment of appropriateness for the newcomers, in addition to implementation stage, clear, and in two phases: training, awareness, embedding CRGs, how all this and how to sustain this through our program. And at the end, I would like to mention that Africa is marching forward with seriousness tested in the assessment of the appropriateness and the use of guidelines. International professional societies, you are here with us today. We need you to cooperate more with the provision of really practical, updated, and user-friendly guidelines that won't interfere with our workflow in Africa. And please help us to future Africa. Thank you very much for your attention.